You would see everything. You know, you'd show up at the clinic. I drove in one morning about 8 o'clock and nobody else is there except this fellow in his 60s sitting on the front steps clutching his chest. And he had had chest pain since about 2 or 3 in the morning and refused to go to the hospital in La Follette or the hospital in Oneida. Wanted to wait until the clinic staff got there. And of course, we hooked him up to an EKG and he's having a heart attack and shipped him off real quickly. But people came to trust the clinic. I saw one guy there, walks in one day, his mom, I thought he was about 40 and his mom had called to schedule the appointment. And I thought, well, that's a little bit different, you know. And so I walk into the room and the chart that the assistant had put in the door said, has a cold. And I walked into the room and this guy had the largest goiter I had ever seen. It was a goiter the size of a football. This huge thing. And I tried not to stare at it, so I kind of, you know, chief complaint, got into why he was there. And then I said, well, you know, I can't help but notice you've got a little goiter there. Does it bother you any? And he goes, yeah, I can't button the top 2 buttons of my shirt. And he said, when I roll over in bed, it kind of, I have to bring it with me. And I said, anybody ever done anything? He said, well, a faith healer breathed into my mouth once when I was a teenager, I think, and it shrunk down a little bit then. I went back to the faith healer again, and it didn't work the second time, and so I just kind of gave up on it. I said, well, what kind of work do you do? And he said, well, I don't. I walked into the disability office, and they just looked at me and gave me disability. And so he said, so I just stay home at my mom, you know, live with my mom, and I talk on my CB to the truckers going down I-75. And I said, well, you know, would you be interested in kind of working on that a little bit? And he was very hypothyroid, huge, massive cysts all over his thyroid. And I took a picture. I said, with your permission, can I take a picture? The head of the Department of Internal Medicine at Vanderbilt was, or at North Carolina was Bob Ney. And I got a little Oneida hardware store ruler so we could tell how big it was. Took a frontal and a lateral view of this and wrote up the story and sent it to Bob Ney. And about a week later I got a phone call and he says, do you think this fellow would come over to our clinical research center? And I said, I doubt it. He goes, we'll pay bus fare. And I said, well, he lives with his mom. We'll put his mom up in the hotel, you know, next to the hospital at North Carolina. We really want to study this guy. Said I took it up to the old endocrinologist who's up in his lab and showed him the picture, and he's never seen anything like it. So I called the guy up and he came in and we talked, and he said, well, I don't think so. I've never been out of the county. I don't think I ought to go over there. We ended up putting him on levothyroxine, the thyroid hormone replacement, and eventually this thing shrunk down to about 1/3 the size that it was. And for the next 3.5 years in Norma, I saw every person in a 3-county area who had any thyroid disease. Just come, I said, can you know, they weren't quite sure how we did it, but it was pretty fascinating to see cases like that.